Good evening, everyone. We want to welcome you to Before the Push, a prematurity awareness discussion with Zeta Phi Beta. And we want to welcome everyone and thank you for joining us tonight. We're going to give everyone a couple minutes to get logged in and then we will get started. Welcome, everyone. All right, so again, thank you for joining us tonight for our Before the Push webinar, a discussion about prematurity awareness. So thank you to those who have been with us before. For those of you that are new, welcome, welcome, and welcome. And I'm pretty sure you're wondering, what is the All of Us program? So just to give a brief synopsis, the All of Us program was an initiative started with the National Institute of Health, and it focuses on precision medicine. So let's say that I have cancer and you have cancer. What do they usually tell us to do? Radiation, surgery, hopefully it goes away, stays in remission. However, what if I have another health condition to where radiation just doesn't work for me and I don't necessarily want to go as serious as surgery? So what precision medicine does is focusing on what treatments are available or creating treatments to make them available to a broader generation or audience in order to be able to treat different health disparities. So as we go through tonight, we are focusing on prematurity awareness. We know the audience that usually has an issue or a statistical issue with prematurity is Black women. So we want to talk about some things before the push in order to provide some more information to our audience, and just so you're able to take away some tidbits and some further education regarding the issue. So before we get started, I would love to bring up my wonderful, wonderful co-host. Again, my name is Crystal Brown. I am the director for All of Us with Zeta Phi Beta Sorority Incorporated, and I'm going to bring up Dr. Siobhan Chambers, who is my lovely co-host. In the meantime, while she's coming up, if you would like to learn more about the All of Us program, you're able to use this QR code that you see on the screen. I'll give everybody a second to capture that. You can also use this Linktree link, my apologies. And then there's also a number at the bottom that is available to you in order to call as well. I will show this QR code again, and I will place the Linktree in the chat. But just so you know, whether you're in the DMV, the Boston area, or the New York area, when you go to the link, you will see this page. This will be the first page that you come to, and you're going to click the target area. If you are not in those target areas, it's best for you to use the number that is under the QR code. So again, I will place this link in the chat. And without further ado, Dr. Siobhan Chambers-Williams.
Good evening, everyone. As Sora Crystal Brown has shared, I serve as the All of Us co-director on behalf of Zeta Phi Beta Sorority Incorporated. And I am so excited as next week, if you did not know, is Black Maternal Health Week. And so in preparation to educate us on the current crisis surrounding Black maternal health, we have 3 amazing panelists that will be joining us tonight. So the first panelist is Crystal Hill Melvin, who was born in Germany and raised in Orlando, Florida. After high school, she moved to North Carolina, where she attended East Carolina University. She graduated from ECU in 2000 with a Bachelor of Science degree. She then went back to school and graduated in 2009 with her MBA and a concentration of HR management. She has been in human resources for over 15 years. She loves what she does because she gets to help people every day. She is the mother of 2 wonderful children. She enjoys crafting, working out, spending time with family and friends, her church, and volunteering in the community. And what's even more exciting is she has been a proud member of Zeta Phi Beta Sorority Incorporated for 23 years and currently serves as the March of Dimes director for Zeta. Our next panelist that you'll hear from tonight is Dion A. Durant, licensed social worker. She serves as the Associate Director of Social Work for the New York City Health and Hospitals Maternal Medical Home Program. She has over 25 years of experience working in the area of maternal child health. She brings a rare mix of community-level hospital-based and foundational level experience needed to impact women's health. She has worked for well-known community-based organizations in the New York area, as well as represented the March of Dimes on several councils. Dion Durant was licensed as a minister in 2009 and ordained in 2018. And what's exciting is that she uses this platform to further the physical, spiritual, and mental health and wellness of her community. And she has been a proud member of, you guessed it, Zeta Phi Beta Sorority Incorporated for 32 years. And our final panelist is Tawana Dennis, who is a 3rd-year Doctor of Nursing practice student at Thomas Edison State University. Upon completion of the DNP degree, she will continue to transform nursing in the areas of academia and policy. Currently, she is a certified womb, ostomy, and continence nurse at a large academic medical center in New York City. She also serves as an adjunct clinical faculty at Columbia University School of Nursing and as a consulting concentrating in expert review of medical records related to standards of care and complex wounds. She is the proud mother of 2 young adults, a life member of Zeta Phi Beta Sorority Incorporated with 14 years of service. As you can see, we have 3 awesome panelists, and at this time, they're going to start with their presentations, and at the end, we will have a Q&A where any question that you may have during their presentation, before you even came tonight, will be answered. First up, I give you, ladies and gentlemen, Crystal Hill Melvin.
Hello, everyone. I hope everyone's had a great day on today. And let me start by sharing my screen. So can everyone see that? Yes.
Yes.
All right. So again, my name is Crystal Hill Melvin, and I am the International Director for March of Dimes and Prematurity Awareness for Zeta Phi Beta Sorority Incorporated. And today I just want to just give you a little bit of background on what the March of Dimes is all about and ways that we can advocate for them and ways that we can get involved. So in order to, achieve what March of Dimes does, it definitely needs partners, which all of the Divine Nine can be a partner. You don't even have to be a part of the Divine Nine to do that. But how you can be a partner is you can be it by being an advocate, which actually some of us, even on the panel list tonight, we actually went to DC on last week, and we were advocates at the in Washington DC with some of our at the White House there. We were able to go to Capitol Hill. We were able to speak to about some of the legislative, some of the different things that March of Dimes is trying to push. And if you look up March for Change in your area, you'll be able to see how you can also be an advocate. You can also volunteer when they come to your area. There's walks that goes on, so you're able to go there and volunteer. They always are in need of volunteers. And you can also donate. And so you can do that by being a fundraiser. That's how March of Dimes gets its word out, is through the fundraising. Of course, everything takes money, and it doesn't just have to be, you think about you can ask other people. I know some of the ways, some people be like, well, with COVID, they couldn't do that. But, right now with everything being virtual, it's really easy. It's as easy as asking 10 of your friends to donate $10. And so some other ways that you can do that is you can download the March of Dimes app, and you can start your team. You can see how you're doing at any given time. It's in real time. You can march your way to hosting a community walk or creating a do-it-yourself fundraiser. So with that, there's walks that goes on in your neighborhood. It's not everywhere, but it's in a lot of places. So you can tend to walk. You can create your own walk just to bring awareness to what March of Dimes does. And then you can do a fundraiser like a bowling event, Zumba for babies. So there's so many ways out there that you could do it. And the March of Dimes website also has a lot of resources that you can use as well. And like I said, you can attend a march in your area. They even have some that are also virtual. And so we are uniting together for the health and equity of opening the door for all moms to have access to care. We are connecting, we are honoring, and we're caring. And so the question is, why do we fight? We fight because over 3.5 million births happen in the US annually. And with this being said, the maternal mortality increased of 38% from 2020 to 2021, which is more than 2 times the increase observed between 2019 and 2020. There are also more than 50,000 US women who experience complications annually. And for Black women, the rate of death was 2.6 times higher. March of Dimes Maternity Care Desert report showed that 7 million women of childbearing age live in counties without access or with limited access to maternity care. These women are giving birth to more than 500,000 babies a year, and this is putting them at risk of serious health illness. And so without the equitable access to healthcare, we can't ensure healthy pregnancy outcomes for families. So if you know someone that lives in a rural area, may not have as many hospitals. I know where I live, there are a lot of research hospitals here. So we have access to those things, but there are people that don't have access to it. They're not able to get to those hospitals. They're not able to get to those appointments. So that's what March of Dimes doing. We're here to be that voice for those moms and babies, and also to get out in our communities and tell people about the resources that are available to them. And so healthy pregnancies and families, this is some of the statistics that I kind of just went over. 50,000 plus families were reached through NICU initiatives. So our actions speak louder than our words. So us getting out there, doing the work, getting together, being a partner with March of Dimes. There's 2,400 patients visits covered by the Mom and Baby Mobile Health Centers, 30,000 healthcare professionals. Sorry about that. Were offered the bias training to improve care practices. So with that, these are the things that, because of the work that we do with March of Dimes, this is some of the impact that has happened. And we imagine a world where every mom and baby is healthy, regardless of their wealth, race, gender, or geographic. And so these are just a little bit more statistics just to show you what is going on in our nation. 106 pieces of state legislation this past year was advocated for to improve natural and infant health. And then just you can see here also the amount of money that it takes. So that's why we do the fundraising, while we do, speak out for it, and we get out here, we do our walks and bring awareness to the cause. And that was my last slide. And I just want to say, that I've been a part of March of Dimes for many years. I enjoy what I do because I get to be a voice for the moms and babies that are not able to be a voice for themselves. And I'm able to, of course, you heard my bio that talks about, what I do for a living, but, I get to help people. And this here is another way for me to get to help someone else, even if you have not given birth to a child, prematurely, just to be able to help someone. But if you hear the stories of the moms that have gone through this, it doesn't just affect the mom, it affects the entire family. And, especially nowadays, a lot of, moms, they may lose a child, and it doesn't just impact them right then, it impacts them in the long run, and impacts, them mentally. They go through, depression, and how that may impact them being a mom or being the best version of themselves. And we know what that's all about, not losing a child. So just imagine losing a child. So, it's time for us to get together, to bond together, and, make a change for mothers and for babies. And if y'all have any questions, I know we have a question time, but you can jot down, this is my email address if you have any questions later that you think of. And thank you so much for allowing me to be a panelist on today.
Thank you so much. That was very informative. So our next panelist is going to continue with another partnership that Zeta Phi Beta Sorority Incorporated has, and that is Sir Dion Durant, who will be talking about stork's nest. So I welcome to our virtual stage, Miss Dion Durant.
Good evening, everyone. Yes, my name is Dion Durant. I'm a proud member of Zeta Phi Beta Sorority. So one of the first slides I wanted to show was a slide of our founders. Our founders started our sorority with the concept of service to mankind. And this initiative, the initiative called Stork's Nest, is one of our longest running service programs to our community. The Stork's Nest dates as far back as 1969, 1968. The program was started in Atlanta with the March of Dimes and several organizations. Zeta made it an official program in 1972. I'm talking about this history because we've been working on birth outcomes disparities for over 50 years. And recently this year, the March of Dimes came out with their preterm report card, and the nation is still receiving grades of D+ when it comes to their rate of preterm birth. And then when you look at communities in our nation, communities of color, many of which still have high incidences of poor birth outcomes like infant mortality and preterm birth. So this is why we continue to do this work. This is why we continue to partner with the March of Dimes. And this is why we continue to do the work of looking at women's health. So what is the Stork's Nest? Historically, the Stork's Nest is a collaboration between Zeta Phi Beta sorority, the March of Dimes, and a community partner. The possible collaborators, those community partners, can be hospitals or prenatal care clinics, community-based organizations with maternal child health programs, or it can even be houses of worship, because several houses of worship have health ministries that are attached to them. And this can be an initiative that we partner with them on. The program is an incentive and education program, provides incentive for expectant mothers to obtain early and regular prenatal care, because we understand that early and regular prenatal care is beneficial to women in that they're able to catch any inconsistencies in health that might impact that birth. The Stork's Nest program also provides clothing and nursery items for pregnant women who use community health services. So it gives them an opportunity to get baby items that they might find difficult to obtain otherwise. It provides educational opportunities for pregnant women to help them make informed choices and decisions relating to parenting, nutrition, and health. And it provides information and referral to community resources to enhance the physical and emotional well-being of mothers and their babies. So the commitment that the sorority has when it comes to the Stork's Nest is all sites must have and must make a financial and contractual agreement to conduct the program for a minimum of 2 consecutive years. So what doing community work, what I know community partners don't like is when you come into a community and do the work that you're granted to do and then leave. So what we want our chapters to do is to have an actual contractual agreement to remain in that community, remain with that partnership for at least 2 years, and then they can continue it. They complete this contract agreement with their partners. They also have to provide a community needs assessment showing health disparities within their particular communities. They must have liability insurance. They must complete HIPAA training because you're working one-on-one with women and their children, and they must have some partnership with the March of Dimes on some level. So these are the parts of the curriculum. The March of Dimes has a curriculum that's called the Becoming a Mom curriculum, and that is what we use to implement the educational portion of the Stork's Nest. And the components are you and your pregnancy, prenatal care, eating healthy during pregnancy, stress during pregnancy, things to avoid during pregnancy, the big day, labor and birth, caring for your pregnancy, and postpartum care. So during the last 2 years, we've all been impacted by this pandemic that some believe is transitioning, but some know is probably here to stay. But during that time when we were quarantining, we transitioned the program slightly. Initially, it's an in-person program. We transitioned it into a virtual concept. And this virtual concept allows the participants to conduct and complete the modules on their own at their own pace. They log in and they register on their own. They can connect with a Stork's Nest through the locator map. And then once they complete the sessions, they receive a gift card. It's a virtual gift card. And they can also connect with their referring chapter. The traditional Stork's Nest is implemented in person, where the nest is actually a site where women receive points for completing the workshops that I mentioned, and then they can shop with those points in the actual nest for their baby items. So these are the virtual curriculum: preconception care, prenatal care, The first trimester, adjusting to pregnancy. The second trimester, your body and your baby. The third trimester, the countdown begins, and thinking about labor, birth, and beyond. The women are encouraged to connect with local chapters to do continuous work around connecting with resources. And we also know that there are a lot of things that impact women accessing care. And we've targeted two specific things, which are food insecurity and access to transportation. We know that in particular communities in our nation, there are food deserts. So we've developed a program that's our birth equity program. And one of the projects is the mobile food pantry. In addition to that, we also are aware that women, even in the urban setting, may have issues accessing transportation to access care. So we have an access to transportation component of our birth equity program, which provides things. In New York, it provides Metro cards so that you can have transportation or pay for transportation. We urge our chapters to connect with national home visiting and other programs that can provide continuous care to the women that participate in the Stork's Nest. Programs such as Healthy Start, Healthy Families of America, Community Doula programs, Sister Friends, which is an affiliate of the Birthing Project USA, Nurse Family Partnership, and Maternal, Infant, and Early Childhood home visiting programs, the Mitch V program. So this is my contact information, as well as my co-director, SORA Dr. Valley Holloway. You can feel free to contact either of us if you have any questions about the Stork's Nest program or to find out if there's a Stork's Nest program in your immediate community. If you have any questions, please feel free to put them in the question and answer box or in the chat. Thank you for the opportunity to provide this information, and I hope to hear from you.
Thank you so much again, Sora Durant. As you all can see, as we discussed before the push, we talked about March of Dimes, we talked about Stork's Nest, but we didn't want to just stick to our two programs that you may already be familiar with. We are so fortunate to have not only a member of our sorority, but she serves in the Greater New York City chapter of the Black Nurses Association. And there's a missing piece to the story about advocacy. So ladies and gents, let's welcome Sora Tawana Dennis at this time.
Okay, good evening, everyone. Thank you for joining us tonight for this important information. I'm going to talk to you a little bit about advocacy and how important that is to Black maternal health. So we've been talking tonight about before the push. And it's very important that we educate the clinical and community stakeholders regarding social determinants of health related to Black women. So both of our other panelists, they spoke about these determinants of health. Can you get to your prenatal appointment? Do you have transportation? So for instance, in New York City, we know you can get on the subway or the bus and get to your appointment. But what about individuals that live in rural areas? They may not be able to access the care that they need. It's very important for us to lobby elected officials. As Dr. Chambers mentioned, I'm a member of the Greater New York City Black Nurses Association, which is part of the National Black Nurses Association, which is a national program. We have over 200,000 members. We have nursing students, we have LPNs, licensed practical nurses, registered nurses. We go along the entire gamut of the healthcare professionals in nursing. So we want to advocate for the Black Maternal Health Omnibus Act of 2021. I'm going to talk a little bit more about that and how we can help with that. And once again, we want to collaborate and coordinate with different stakeholder organizations, whether it's your faith-based organization, community organizations such as Theta Phi Beta Sorority Incorporated, such as the National Black Nurses Association, and see how we can get this bill passed. So here we see a photo of Serena Williams and her daughter. So the top 5 reasons that we have maternal morbidity and mortality are high blood pressure, infection, heart disease, hemorrhage, and pulmonary embolism, which is just a term for a blood clot that can go to the lungs. So we know Serena Williams, she's healthy, she's wealthy, she's in great physical shape. However, she had a pulmonary embolism after giving birth to her daughter. That's a very serious disorder. It could even lead to death. So it just goes to show you, many people say, oh, it's about race. No, it's not about race for a Black woman. It's really about racism and the implicit bias that goes along with the care that we often receive. So I want to promote and let everyone know, when you're pregnant or even postpartum, there's certain symptoms you should look for that need to be reported and should seek medical attention for, such as headache, edema or swelling of your legs, feet, hands. Your blood pressure is more than 140/90. Purulent drainage at your C-section wound site. If you have a, C-section, if you have some type of purulent drainage, extra bleeding, pain, foul odor, you need to report that. You need to seek medical care. Heavy vaginal bleeding with clots. If you have any fever or chills, seek the medical attention. And it's very important that you individuals advocate for themselves, or if they have family members that can go with them. Also, we spoke about the doulas. They're very helpful and a support system for when you're seeking medical attention. But you please make your symptoms known, encourage your loved ones. You can be an advocate for them, let your symptoms be known. Do not allow the providers or the physician or the certified nurse midwife, when you go to your appointments, or God forbid you have to seek emergency care, don't let them turn you away. You stay there until you get the treatment that you need. So the Black Maternal Health Momnibus Act of 2021, it's a comprehensive bill to address and reduce and eliminate maternal mortality and morbidity. So the United States, as rich as we are and all the different things that we have the highest rate of maternal morbidity for developed nations. Morbidity, this means that mothers are dying giving birth. In the United States, 17 deaths per 100,000 live births. For Black women, 42 deaths per 100,000 live births. Let's just stop and think about that for a minute. That's triple what other women, the number of deaths for other women who give birth. And when we look at other developed nations, like in Europe, they have a rate of 2 to 8 deaths per 100,000. So the background for the bill was first introduced in February of 2021 by Lauren Underwood. She's a Democratic Congress member. She also happens to be a registered nurse, and she has a graduate degree in public health. So she wants to do something about these poor outcomes for Black maternal health. So she introduced this bill. And once again, it wants to promote collaboration between federal, state, and local stakeholders to improve Black maternal health. So the bill has 12 parts to it. Once again, the social determinants of health. Does the mother or the person giving birth have appropriate housing? Can the mother get to her appointments? Yes, once again, New York City, I grew up in that area. I still work in that area. We can get a Metro card. You can get on a bus, the train, and get to your appointment. What about individuals who live in rural areas? They may be 1 hour or more away from a certified nurse midwife or physician. Once again, working with our community-based organization, giving funding and grants to churches, different houses of worships, grassroots organization to provide services and partner with organizations such as the March of Dimes or different Greek letter organizations. Also, they want to look into the veterans' health. Also, our perinatal providers, we have to provide some type of training regarding implicit bias. When you see your provider, your doctor, your nurse, midwife, are they just looking at you based on the color of your skin, or are they looking at you as an individual? So a lot of funding and financing needs to go to that, so that people such as providers can provide that culturally competent care. That's so important. We also want to do some data collection, because all of us is all about research. So we can't do the research to see what can work best, why this is happening. We already know the research has shown us it's not because of race, it's not because you are a Black woman, it's because of the implicit bias and the racism that happens. Also, the factor regarding mental health. We want to also, the bill looks at incarcerated mothers, the use of telehealth, the different payment models, which just mean how are obstetricians being paid, certified nurse, midwife? Do they get the same payment as a physician? Payment for doulas, which are support persons that can help the mother giving birth throughout the pregnancy, prenatal appointments, and postpartum. COVID-19, we know the global pandemic, there was a lot of changes that went on with that. People had difficulty with access to care. At one point during the height of the pandemic, we know that visitors were limited to the hospital setting. So it was very difficult and challenging for mothers to give birth alone if you couldn't have a support person there. Climate change, we know that's having an effect on many parts of our of the world. So there's going to be funding surrounding that. And also vaccinations, just making sure that everyone has all of their correct vaccinations, especially the moms, when we look at prenatal care and health. These are just some references here, the Centers for Disease Control. And if you have any questions or answers, we're going to have that question and answer period for you. Thank you for the opportunity to speak to you today about Black maternal health. And also, please remember, next week, April 11th through 17th is Black Maternal Health Week.
All right. If you have the reactions button in your Zoom app, I just ask that you send some love to our 3 panelists. It takes a lot of courage to come before a virtual audience and just share key facts. And so what's exciting, we did have a few questions come up. And so the first question I'm actually going to give to Dion Durant, because she answered it in the chat, but just in case you can't find the chat button. So the question, Dion, was what kind of advocate can we request during pregnancy, and is there a cost? And if someone else wants to add on after Sora Durant, you are more than welcome.
Sure. Immediately when I saw the question, the first thing that came to mind is the community doula programs that are across the nation. That is probably the best advocate for a pregnant woman. They have prenatal doulas as well as postpartum doulas, and they provide a much needed service to women during pregnancy, and they advocate for you during that delivery and labor period. So if there's a community doula program, that's probably what I would say it would be the best advocate for any pregnant woman. There are community programs that have them for free or at low cost, depending on where you are in the nation. I know there are several programs. There's actually a citywide doula program in New York City that provides free doula care. But that may not be the case throughout the nation. But there is a lot of advocacy happening to increase the Medicaid reimbursement for doulas to make them more accessible to more people.
All right, and that was actually the next question I was going to ask, but you answered it in your response. Thank you, Sora Durant. So another question is the stats for Black women in the United States of 42 to 100,000, or out of 100,000. Is that stat similar in Europe for women of African descent there as well? Does this affect Black women everywhere? Finally, is it worse in certain areas of the United States for Black women? So you want me to go again one at a time? So the first part, and any of our panelists can answer this, just repeating it again, is the stat of 42 out of 100,000, is that similar in Europe for women of African descent?
I could take that question. The stats that I gave were for the United States, but they found, as I mentioned, that the rate is only 2 to 8 per 100,000 births in other developed countries. So that's statistic is less even in Europe, because their model of care is a little different. For instance, for postpartum, I believe they can get up to 2 years or 1 year of postpartum time off to be with their infant to bond. Also, they do more primary care, preventative care than we do here in the United States. So the rates that I mentioned was for the United States, which is very troubling because we're considered a rich country per the World Health Organization, but our outcomes do not show that.
Okay, and the next part, does this affect Black women everywhere? And are there is it worse in certain areas of the United States for Black women?
Let's see. Theon, do you have any statistics from the March of Dimes as far as different
Right.
states?
So the March of Dimes, as I mentioned, they come out with an annual report card for preterm birth. And some states do fare worse than others. Hold on one second, I'm sorry.
And I can kind of pick up there, and some of the states that are the highest are like Wisconsin, Idaho, New York. There's actually, if you go to the March of Dimes page, there's a report card. Kind of looks like this right here. I don't know if you can see, well, you probably can't see it, but it goes by state and it tells you the ones that are the worst versus the ones that are, we're all bad, because as a whole, we all rate a D as the United States. So we're not good. No one's better than the other, I don't think, but it will show you this. It has race and ethnicity disparity by state. Sorry,
Okay.
Durant, you want to add to that?
I was actually trying to pull it up so that we could show it, because the visual is where the impact is. And in fact, they have another visual which looks at pocketed communities. And a state may have a C grade or a B grade, but there are certain communities within the state that have failing grades. You can actually see that in places like New York, where New York, I believe, received a C. Yep, a C. But there are certain communities in New York, like Central Brooklyn, like Brownsville, that have for years had poor birth outcomes. And so this is what the problem is. And it usually correlates with communities of color. And if you look at the map, states like Louisiana, Alabama, Arkansas, all have failing grades when it comes to preterm birth. And so the question is, what are these states doing? What is the makeup of those states? And what are the missing links that we need to be providing to our communities of color to make sure that our outcomes, that there's no disparity, that the healthcare is equitable across the board, and that Black babies survive.
Wow, we definitely, and please keep the questions coming. Thank you, Karen Hall. She said, thank you for answering her questions live and that this has been informative. So one question, I don't want to lose it, but I thought was powerful is from Rachel. And her question is, what about resources for the 4th trimester? So I know this is titled Before the Push, but Black maternal health includes the 4th trimester. So I'm not sure if Sir Dennis wants to start with responding to that 4th trimester question, but and you're getting a lot of love in the chat for this question.
Yes, so the 4th trimester, or it's really is the postpartum area of maternal health. So you're giving birth, you're now home with your infant, and what services and resources are available. Some women, unfortunately, may experience postpartum depression with psychosis or whatever, which can lead to harm to the baby or to themselves. Also, once again, even though you're giving birth, you made it through your pregnancy, prenatal, you can still have the complications, like Serena Williams had the pulmonary embolism. Some women have infections. They may have hemorrhage or bleeding. So once again, you have to go for those follow-up appointments. You have to go to that the emergency room, back to your provider or the hospital. If you have any complications, you need the different support services of your family, whatever community-based organizations or faith-based organizations that can help you also. Dion Duran, would you like to add something else to that about the 4th trimester?
Sure. I'm always going to stress those doula services, because that postpartum doula care is beneficial during that period. And just to give a helping hand to mom during that time, and to be around to flag those things that might come up. But there are other programs that I mentioned, the Healthy Families of America, which is a home visiting program, the Nurse Family Partnership, which is another home visiting program, the Mitch V program, which is another home visiting program that come alongside that family, the family unit, and make sure that they have all the resources that are necessary to support that mom during that period, to catch anything during that period, and to support that infant during that period. So yes.
All right, we had another question. Oh, I'm sorry.
Before we go to the question and Q&A, we know that technology is not always on our side. And I did see Lois Francis Harrison has her hand up. So I'm not sure if she's able to put her question in the chat, but her hand's been up for a while and it might be a good question. So I just wanted to direct her. If she can't find the Q&A, you can also just put it in the general chat and we'll make sure that your question is asked.
All right, and while she is doing that, the next question is there an advocacy website that we can visit to contact our local legislators to bring more attention to maternal health?
I know if you go to the March of Dimes page, that March for Change page that Sora Hill Melvin mentioned, that they have a sign up there for you to sign up for their advocacy, and then they would help you with the connecting with your elected officials.
Yeah, you can go there and sign up, and you can get information sent to you. Like they're having one here locally where I live on the 25th. But once you sign up and say that you want to be an advocate, you'll start receiving emails and information for the area that you reside in.
All right, and then one more. Does age impact any factors impacting maternal health? Impacting Black maternal health?
All right, so age is a factor for all pregnancies. Once you're over age 35, they consider you can be high risk pregnancy. But once again, as we all discussed tonight, with Black maternal health, even advanced age perfect health, wealthy, you're still going to have potential for poor outcomes related to implicit bias and racism. So yes, advanced age is a factor, but the racism and if they don't provide the culturally competent care is a bigger factor.
All right, I'm doing one more check through. Okay, Laura said that was an error in raising her hand. All right, I do not see any more questions.
All right, so on behalf of the All of Us program and myself and Sora Brown, who serve as the directors and co-directors for Zeta, we want to thank all of our panelists for not just the great information, but also answering these on-demand questions. You're getting a lot of great feedback. And what we will do is any of the resources that were shared tonight, we will send a thank you email to all registrants. So sometimes you register, but you don't get to attend. So we will be sending that out so that everybody can be well informed. Before you go, I just want to show our call to action, because what's important is Black maternal health is lacking important information, and that information starts with us. So if you have been attending these events and you want to learn more, I encourage you to scan the QR code. And when you scan the QR code, you will see the first link says join all of us. And this is for individuals who do not reside in Boston, New York, or the DMV. Now, Zeta, we have a special charge with our partnership with the All of Us program, and that is here in the Atlantic region, 3 target cities that have an HPO, meaning you could go and enroll directly, is New York, Boston, and DMV. And so we are excited to keep doing these programs because who knows, somebody on this webinar tonight, you may be the missing link to figure out how can we get these startling statistics down, because it impacts all of us. So on the next slide, you will see our link tree that I mentioned. And on the link tree, you'll see home, join all of us. But then if you're in the Boston area, you'll click Boston. If you're in the New York area, you'll click New York. And if you're in the DMV, you'll click DMV. For my tri-state, especially New Jersey, who is representing as well, New York is not that far from us, so you definitely can click the New York link. We want to thank you all for coming out, and we hope that you have learned something new. And please look out for all programs around Black maternal health that starts next week, April 11th. Have an awesome night.